Hi everyone, my name is Dr. Amir Khan, and I don't have any slides, unfortunately. It is just me that you're going to be looking at, so I apologize for that in advance. I'm a complete technophobe, like complete technophobe. So this just having kind of a virtual meeting is like a big deal for me. I know you're all really young and you can do a million things on your computers all at once, but I can't. This is about it. And to give you an example of how bad I am with technology, really. In general practice, through the pandemic, we do a lot of virtual consultations with patients. So we often have to do video consultations, similar to what I'm doing now. And we work from home occasionally as well when we don't have to go into surgery, if we're doing telephone consultations and video consultations, and minimize kind of going into surgery and kind of spreading things. I was working in my study, which is this room that I'm in now. And I had ahead of me here are some French doors, and I had them open, and I was talking to a patient, a video call very similar to this, and two starlings flew into the room because the door was open, and they did that thing that birds do when they fly, and they just went absolutely crazy, and I kind of panicked, and the patient kind of panicked, and I was chasing these starlings round the room. I fell over the chair behind me. So it was a complete disaster. I think I ended up sicker than the patient at the end of that call. So I'm not really great at these kind of video calls. So I'm hoping you can see and hear me now. Right. So I'm going to talk to you about my career really in primary care, how I got there, what I do, how varied a career in primary care can be. And then I'm going to finish with my forage into media medicine. I do a bit of media stuff. In fact, I'm filming something today, and I'll talk to you about that later. So I know I don't look old enough, but I've been a doctor now for coming up to, it'll be my 17th year, and 11 of which I've spent being a GP, which I really enjoy. And I remember applying to medical school, and being of South Asian heritage, there's kind of an expectation of you to try and get into medicine at least. I didn't know whether I wanted to, but I knew that is what my mum wanted me to do. So I didn't really have much of a choice. And so I kind of applied thinking, gosh, everybody who I know who's applying really wants to do it. And they've all got these big dramatic stories about, oh, I got really sick and then someone saved my life and I wanted to be just like them. And that's why I want to be a doctor, because I want to help people the way that person helped me. I'm fortunate enough to have led a fairly healthy life, and I didn't have a big dramatic story like that. So I felt a bit like a fraud applying to medicine. And I imagine there's lots of people who feel that there's better people out there who should be applying to medicine. And that's how I felt. But what I will tell you, if you're feeling that way, if you're sitting there and you're watching this going, oh, there's so-and-so in my class or in so-and-so that I know that is much cleverer than I am, who's got a better reason to do medicine than I have, or so-and-so's told me I'm not clever enough to do medicine, which is, I got that all the time, to be fair. I was very kind of middle of the road when it came to kind of being the clever person in the class. I was in the middle. So I would say if you really want to do medicine, or if you think that is the career for you, and it doesn't have to be medicine, it can be nursing, it could be pharmacy, a career in healthcare, then you should do it. And don't let anyone tell you you can't do it, because if I listened to them, I wouldn't be doing what I'm doing right now. And it took me a while to realize that my mother was right. I should have applied to medicine and it's the right career for me. And it wasn't until I was a GP really that I settled into that kind of thought process. I realized quite early on, and you'll see this because I'm just talking and talking and talking, that I like talking. I like talking to people. And the only real experience I had growing up in terms of seeing a doctor was seeing our family GP. And it was very different back then. A lot of the pressures that are on general practice now weren't really there back then. And there was this old idea of kind of having the family doctor who knew you, who knew your family, who knew the community. And that really appealed to me when I applied to do general practice. I like the idea of working in the same practice, and I've been in the same practice now for 10 years. And even though there is a lot of paperwork, a lot of red tape, a lot of tick boxing, that is the same across all aspects of healthcare, really. But when it's just you and the patient in the room and they're telling you their story, there's something very old, ancient about that. That kind of relationship between the doctor and the patient has been around for hundreds of years, hundreds of years. I know it's been modernized in the through the NHS and through the recent kind of years, but you still kind of capture that. And what's quite nice about working in primary care is that you see patients, over and over again. You build up that relationship. You get to know their mums and dads. You get to know their brothers and sisters and their children. And that part of being a GP or working in primary care is still there. And that's what I really enjoy. Just the other week, I said these words that I've been dying to say for years. When a kid came to see me with his mum, and I said, I remember when you were just a bump in your mum's tummy. And I've been wanting to say that because I remember my GP saying that to me. But the mum, unfortunately, gave me a really furious look. I think she'd explained to the child where babies come from. So I kind of ushered them out very quickly after that comment. So yeah, that didn't go down too well. But what I'd like to talk about in primary care is really what I do. So GPs now, it's a very different role to what it was. And primary care does look very different to what it is. GPs play a very small role in the primary care team, an important role, but a small role, just as important as anyone else, really. And where I'm lucky enough to work in a really big practice with lots of different people there. So we have our amazing admin staff, so our reception staff, our secretaries, all the finance people, because working in general practice, it's a bit like running a business because you own the building, you own the contract with the NHS. It's all very complicated. So they're all brilliant and they do stuff that I could never do. I'm terrible with not only technology, but with finances as well. That's my missus. So there's that side of things. And then the clinical staff, and our clinical team is really wide. And this is really important for patient care. So we will have, nurses, nurse practitioners, physiotherapists, occupational therapists, midwives, practice nurses. Oh, I've mentioned them twice. That's because nurses are the backbone of the NHS. We've got pharmacists as well, both prescribing and non-prescribing pharmacists. And I'm sure I've missed out lots of other people, but those are the people you're building. And all of them play a massive role in delivering healthcare to our patients. So if a patient rang up with back pain or shoulder ache, they are much better off seeing a physiotherapist in our building than they are coming to see me. That physiotherapist knows more about that condition than I do and will be better suited to manage it. And if they feel a doctor needs to get involved, then the physiotherapist will just come and see us and we'll see them. And it's a really kind of well-oiled machine. So if you are thinking of a career in primary care, it is not just GPs. Honestly, that is a really old-fashioned idea. It's a whole host of really important people that deliver that care. Now, if you are thinking of being a GP, I would be a huge advocate for the job, because despite all the stresses, it is still a really, really good job, and you can do so much. Seeing the patients in a routine clinic is important, and it's really, really good for the patients. But I do lots of other things, and lots of GPs up and down the country have something called a portfolio career, which means they vary their work. So as well as doing day-to-day general practice, I'm also a GP with a special interest in diabetes. So that means I have done some extra postgraduate training in diabetes, got a diploma, and some training in hospital clinics as well. And where I work in inner city Bradford. It's very glamorous, obviously, Bradford. And we have a huge diverse population, which is why I want to work there, really, because we see such a variety of people. We've got a huge South Asian population, we've got a huge Eastern European population, and we've got a huge Caucasian population, and we've got everyone else as well. And all of that kind of brings in variety, because they come in with different health expectations, different ways of communicating. You have to adjust your consultation according to the patient in the room as well. And that spans across different cultures. And I quite like that variety. And there's the age-old kind of thing of you don't even know what's going to walk through the door. You know, if I was a colorectal surgeon at a hospital doing an amazing job, there's only so much variety that they're going to see that day, but they're going to do amazing surgery. But through my door can come literally anything and everything. Over my 11 years as a GP, I've seen quite a lot of stuff. And so I do the diabetes. With that, I manage people on insulin or start insulin. I also do minor surgery. So we take off things like cysts, ingrowing toenails, which sound gross, but actually are quite good fun. And lots of kind of benign lumps and bumps that are causing patients distress. So we do all of that. I also do joint injections, which is, again, just varies the week across. One of the other big things I'm involved in is medical education. So I have trained lots and lots of medical students, usually from Leeds Medical School, but we get them from on elective from King's College and Imperial College as well. We've had lots of international medical students come to us too. But it's not just medical students that I train. I've been really heavily involved in developing physicians associates, both at Bradford and Leeds University. I train nurses, and I was really involved with that across Yorkshire and Humber. And also physiotherapists, occupational therapists. We get paramedic students coming through our doors as well, and we're involved with training them. And then postgraduate training, I do a lot of that. So I train other GPs. I train pharmacists who want to prescribe and become clinical pharmacists, and that is see patients in clinics similar to what we do. I train nurse practitioners as well, and they are absolutely brilliant, and they can see acute things similar to what we do as GPs, undifferentiated medical problems, diagnose and treat them. They're brilliant. So I do a lot of kind of training, and education is a big part of what I do. I really enjoy it. I'm also a senior lecturer both at Bradford and Leeds University, and I do a lot of the medical school admissions for Leeds University as well. So it keeps my week varied, and it keeps it interesting, and that's really important when it comes to any job, really, because you don't want to go in doing the same thing in and out. And I think if you work in the NHS, that's unlikely to happen anyway, because so many different things can influence your day. But yeah, it is hard work, but it's really important work, and I really enjoy it. So that's my education stuff, and I'm going to talk to you now a little bit about my media work. So I never planned to be a media doctor. I was quite happy being a GP, and I still am a full-time NHS GP. So all the media stuff I do is very much on the side of that. I use my annual leave or my day off or my weekends to do it. So it is hard work. The way it started really was a completely bolt out of the blue. We got a call from a show called GPs Behind Closed Doors, and that was 2 years ago, maybe just over 2 years ago, about 2.5 years ago. And the producer called us up, and it's a show, if nobody's seen it, it's a show on Channel 5 that is literally just a fly-on-the-wall documentary about life in general practice. So it's not just GPs that they film all the wide array of healthcare professionals that work in general practice. But it's more about the patient stories rather than us as individuals. And so we got a call, and this was the 6th series of this show, and all the previous ones had been filmed down south. So they filmed quite a lot in London. The last series was in Bristol, and I think they thought, right, it's time to slum it. Let's come up north and film it there. And they'd already been to Liverpool, Manchester, and Newcastle, and we were the last practice that they were going to come and see. And people from London have this habit where they kind of lump the north together. So they kept saying, we want to film up north. We've been to Liverpool, Manchester and Newcastle. I was like, they're very different cities. It's not just the north. But they came to Bradford, and I remember it very clearly. The producer, the owner of the company that makes it, came. He was very much a London lad. He'd come on one of those kind of fold-up, trendy bikes that you can kind of just put under your arm. He got the train up and then cycled from the train station in Bradford up to our practice. I don't think he'll ever do that again, because if anyone's driven in Bradford, they'll know that drives in Bradford are just like on a whole different level of dangerous, and you should not cycle. He learned an important lesson that day. Anyway, he had a look around the practice. He met up with myself and one of our nurse practitioners called Debbie. We showed him around, and Debbie had made him a nice lemon cake, which I don't think they did in Manchester, Liverpool, and Newcastle, and that's what swung it for us. So they decided to film at our surgery. And like I say, we're a big surgery. They only wanted 6 consulting rooms, and they put fixed cameras in these rooms, and they had a whole team of people at the surgery, some of which were consenting patients out in the waiting room, some of which were watching our every move on camera upstairs. It was all very strange. And they filmed that show for the best part of a year. It was a long, long time. And the interesting part about that show was all we would do as the clinicians really was come in the morning as normal. They'd fit a microphone on us, and then we'd go into our consulting rooms, and we would still see patients at these 10-minute intervals. And we had no idea which patients had consented to being filmed and which patients hadn't. The vast majority of patients didn't consent to being filmed. So you just didn't know, because all of that took place in the waiting room where we were not working. And yeah, it was a really interesting experience. It fed back really well. I think we had kind of the warmth that people in the north tend to have. I'm biased there, I know, and so it fed back really well, and we made really kind of good friends with the team. We did play some pranks on them because when someone's there for a year, you get to know them really well. So one time, I had one of my friends come in and pose as a patient and pretend to book onto my list, and he was sitting out in the waiting room. The team, the GPs behind closed doors team, didn't know he was like not a real patient, and so he came in. They consented him, and he came into my room, and it was all a thing that we'd set up. But it was so funny. He said to me, he said, "Oh, Dr. Khan, I've been away to Magaluf," and we all kind of know what happens in Magaluf, and I've come back, and I think I've got a problem down below. So okay, yeah, let's check your urine and see what's going on. So he went to the bathroom. He had a fake kind of bottle of urine, which was orange squash. But again, the people who didn't know this. So he came back and he went, "Oh, here's my urine sample." So I unscrewed it, and then I pretended to take it. Well, I did take a sip of it, and I went, yeah, definitely chlamydia. and so we kind of ended the consultation. He went out. And the next morning, the producer came down and she went, "I just want to talk to you about a consultation from yesterday. I just want to make sure that the GMC will be okay with this." And at that point, I had to come clean and say it was a bit of a prank. And then we did something similar. One of my colleagues, she got her husband to pose as a patient, and again, it's just for a laugh, really, because they'd been there for that long. And he'd pretended to be a patient. He got consented, and he came and sat down in her room, and he was like, "Oh, Doctor so and so, I just can't stop thinking about you since our last consultation." And she was like, "No, stop, because I can't stop thinking about you." And obviously, it kind of crescendoed, and it led to them having a bit of a kiss. Bearing in mind they're husband and wife, and it was just an act. And then it took 3 days for the producer to come down and speak to me, because I was their go-to guy if they had any issues. And she went, "I just need to show you something, Amir. I just want to make sure that you're aware that this might be going on in your surgery." So that was very funny. But the show, like I say, was received really, really well. And on the back of that, I did some other work. So I've done some other shows for various channels. I was in a show called How to Lose a Stone in a Month, which was about cutting out really bad food. And then I did something called The Science of Sleep with another presenter, looking at what will happen if we're sleep deprived. I know there was a talk about that earlier on. I did a show with Dr. Christian, which had the brilliant title of The Great British Urine Test. I won't say too much more about that, but it was really interesting. And I'm working on a couple of new shows at the moment, which is very exciting. And also I do regular slots on ITV's Lorraine, BBC Breakfast. I was on that this morning, and so it's all kind of just taken off. And I know there is a lot of interest in becoming a media medic or a media nurse or just a media kind of healthcare professional. And what I would say to people who are doing it is if that's really what you want to do, then do it, because it is good fun, it's enjoyable, and if you're passionate about it, then by all means do it. It's hard work. So I wasn't on social media a couple of years ago. Now I'm on Instagram and Twitter, only because Channel 5 asked me to do so for GPs Behind Closed Doors. But it's hard work keeping up with all of that. It's hard work doing your day job and doing the media stuff. The one thing I would definitely say is don't sacrifice your day job, your NHS job, for media work. It is not worth it, because that media work, it's time limited. I know I'm not going to be doing that for years and years to come, but I do know I'll be a GP for years and years to come. So it's nice to know when that dries up, I will have the fallback of having a great job and a job that I really enjoy. And I don't want to sacrifice that for the media work. And you have to have a bit of a thick skin, because social media isn't always a pleasant place. So you definitely have to have a thick skin, and that you learn very early on, and it is not easy at all. But if you can find the balance between the two, then you're onto a winner, and that's the key. And it is persistence. It doesn't happen overnight, and you kind of have to build it up, and there's opportunities that will come to you, and you just have to kind of work at them and make them as good as possible. And the other thing I've done is write a book, which again I never thought I would do, but it's a book about my life as a GP in general practice. Obviously, lots of things have had to be changed and anonymized, but yeah, that's out in August as well. And again, I never thought I'd be a writer, but here I am. And so what I would say is just don't say no to opportunities. That was my plan. And things have so far gone well for me. So fingers crossed they continue to do so. And I hope that's given you an insight into my career as a GP and then my forage into media work as well. I think there might be some questions. I don't know. I'll wait and see. Okay. Yeah. So there's no time for questions. Sorry. I hope I answered anything that you might have asked. But yeah, thank you so much for having me, and see you soon. Take care.